Hi everyone, it's Dr. Lee here. So today I'm doing a very special case. My patient is a good friend of mine that I've known since childhood. Now she's a mother of two. She's had two beautiful babies. So she's really put on a good amount of weight kind of around the center of her body, around the waist. So today I'm going to be doing liposuction. Her focus mainly is just the front and the sides. So I'm definitely going to be contouring her abdominal area as well as her flanks. Hopefully get her back to more of an hourglass shape and what her body used to look like before she had her children. All right, so I just finished with the surgery. Took out about 3.5 liters of a mixture of liquid and fat. She definitely has some improved curves along her waist, and her skin is just much thinner, even and thin when I pinch it all along. The skin, she does have a little bit of loose skin. The skin will tighten up on its own after the surgery because she's still young and she still has some elasticity to her skin. The patient does have a little bit of scoliosis. You can see that her body naturally curves a little bit. She's had back surgery in the past. So what I do is just try to compensate a little bit more in her shaping to kind of make her look a little bit more midline, even though she does have a natural curve to her body.